Good morning, everyone. I'm Dr. Jyotsna Sharma, Professor of Pharmacology. And as all of you know, we are starting with today's new topic. So today I will be starting with introduction of general pharmacology. As we are meeting, so let's start with the introduction part first. So let's start with introduction of general pharmacology. Start with introduction. So let me tell you about the definition. When we say pharmacology, then this word pharmacology has come from the pharmakon and logos. Logos, as we say, is study, and pharmakon actually is a word which has come from the active principle. When we talk about active principle or when we talk about drug, then we use a terminology called pharmakon. So when we are studying the study or when we are studying about the active principles, then we say we are studying pharmacology. So that is a branch which deals with the study of drugs. Now a little bit about the history of pharmacology. When we say about history, then first name which comes is father of Indian pharmacology. As we are talking about Indian pharmacology, so father of Indian pharmacology is Colonel R.N. Chopra. Sir Colonel Ram Nath Chopra is actually in 1921. He was in the School of Tropical Medicine in Calcutta. He was HOD of Pharmacology at that time in the Calcutta Medical College. From 1941 to 1957, he was Director in Drug Research Lab at Srinagar. And Sir Colonel Ramnath Chopra first introduced and studied especially on Rubelphia serpentina. So he has got a huge contribution towards the Indian pharmacology, and that is why Sir Colonel Ramnath Chopra is father of Indian pharmacology. Next name which is important comes as Oswald Schmidberg. Oswald Schmidberg, sir, is known as father of modern pharmacology, and again he has a huge contribution in modern pharmacology. He has written a classical text on outline of pharmacology. He has discovered glucuronic acid. He has worked on urethane, hypnotics. So again a huge contribution in modern pharmacology. Sir is father of modern pharmacology. Next name is Louis Lasagna. He is father of clinical pharmacology. You just need to remember these few names when we talk about history of pharmacology, especially father of Indian pharmacology and father of modern pharmacology. Then this Louis Lasagna, again, he was actually in the clinical department of Johns Hopkins University, and his Louis Lasagna basic role is in conceptualizing about the clinical trials, controlled clinical trials, and he studied even placebo effect. So this placebo effect was introduced by Louis Lasagna, and about the clinical trials, so that is why he is father of clinical pharmacology. I'll tell you later on what is the meaning of clinical trials, how do we do those things, and what actually is clinical pharmacology. Next name is Francois Magendie. Francois Magendie is pioneer of experimental pharmacology when we talk about different experiments which we perform in pharmacology. And he has worked, he has introduced morphine, codeine, quinine, strychnine. So all these drugs, he has studied the experimental work on these particular drugs. Next name is Claude Bernard. He is father of modern experimental medicines. This Claude Bernard was actually a student of Francois Magendie, and later on he also worked on experimental medicine. He worked on pancreatic juices, liver glycogen, their importance, and its work is very pronounced in the vasomotor system, like especially on the working of vasodilatation, vasoconstriction. So Sir Claude Bernard on that. Next name, again a very important name in pharmacology, is John Jacob Abel. He introduced this term pharmacology per se for this particular subject. Earlier we used to have a terminology called materia medica. Earlier we were using materia medica terminology for pharmacology, but since John Jacob Abel has introduced this term pharmacology, since then this pharmacology is used per se as the subject. So this is about history part of pharmacology. Now move forward. If we move forward for the general pharmacology, then next comes the different terminologies related to pharmacology. Different terminologies, different subsections or divisions of pharmacology. Under which headings are we going to study this particular subject? So first of all, let's talk about pharmacokinetics. It is one of the major branch of pharmacology, pharmacokinetics. As the name is saying, pharmacon, as I have told you, pharmacon is drugs. When we are dealing with drugs or when we are talking about active chemicals or active ingredients, then it is pharmacon. And kinetics, as all of you know, kinetics means movement. So the movement of drug, when we are talking about movement of drug in our body, that is pharmacokinetics. When we discuss about that, so what all do we study in that? When we say pharmacokinetics, then we actually do these studies, ADME or ADBE. A stands for absorption, then D for distribution, B biotransformation, or maybe we can use another terminology which is called metabolism, M for this, and then E excretion. So whenever we are studying the effect of all these, when we are observing or when we are assessing or judging or studying these effects like absorption, how absorption is going to take place when we take a medicine, or how that particular medicine is going to distribute in our body, what happens during the metabolism process, and how does these drugs they get excreted out from our body. So all this movement of drug in our body, that is when we talk about pharmacokinetics. In another terminology, rather few of the senior consultants or few of the senior professors of our field, they like to hear this terminology for pharmacokinetics. It is what the body does to the drug. As soon as we take a drug, our body is going to act on that particular drug. And what happens, what our body does to the drug, that is called pharmacokinetics. In this, when during this course, when we study absorption, distribution, metabolism or excretion, we actually, what we are trying to know from that is, we want to know about the time course of drug concentration. What is the time frame, a particular drug, how much concentration does it achieve at what particular time duration. We talk about order of reaction, which type of reaction order it is following. We want to know about the plasma half-life. I'll tell you later on what that is, plasma half-life is. What a steady state concentration means, a concentration which is going to remain steady for a longer duration of time and which is maintaining a therapeutic concentration which is required for a drug to produce a specific action. Then we, as we are observing or we are studying these different effects of absorption distribution, then at that time we are discussing about therapeutic drug monitoring, which is required therapeutic drug monitoring. As the name is saying, let me just give a hint about this plasma half-life as well. When we say plasma half-life, it is actually a time duration which is required for a particular drug to achieve or to reach to a just half concentration of what we have taken. For example, if we have taken a 500 milligram of a certain tablet, for example, take an example of crocin or a tablet of paracetamol. If we have taken a 500 milligram of paracetamol and if it reduced to its concentration of 250 milligram in 4 hours, then the plasma half-life is 4 hours. Means the time duration which is required for a particular concentration to reduce it to half of its original concentration, that is called plasma half-life. So from this studies of pharmacokinetics, when we study pharmacokinetics, we come to know about plasma half-life. What is the plasma half-life of a particular dose? Accordingly, we are supposed to give or supposed to repeat the dose of that particular drug. Then the steady state concentration, as I have mentioned, then the therapeutic drug monitoring. Therapeutic drug monitoring is we are maintaining a particular steady state concentration in the blood of our drug so that it can achieve a particular target and can produce its therapeutic effect. When any drug is producing any therapeutic effect, at the same time it is having certain adverse drug reaction as well. So there's a marginal window for each and every drug. For the level that it is a safer level, then the therapeutic level, and after that there is a toxic level. So the drugs which are having narrow therapeutic window means concentration which is required to produce a specific drug effect or a therapeutic effect, and a concentration on which we are going to produce or that drug is going to produce some certain adverse drug reactions. So that therapeutic window, if that is narrow, then we need to do certain monitoring on those drugs. We need to keep a check on plasma concentration of those drugs, and that concentration check is called therapeutic drug monitoring, where we keep a check on concentration of that particular drug. Next thing which is important is drug dosage and dosing schedule. By knowing this plasma half-life, we know that how much drug has to be given at what particular interval. So dosing schedule can be derived from that. So all these things are actually which we study when we talk about pharmacokinetics. Next branch of pharmacology is pharmacodynamics. As all of you know, dynamics means power. We use this word for power. We say na this personality banda bada dynamic lagta hai bhai. So dynamic is power. When we show that something is powerful, then we use the word dynamic. So here we are talking about dynamics of drug, pharmacodynamics. So how powerful that drug is, that we study in pharmacodynamics. It can be defined as the study of biochemical and physiological effect of drugs and their mechanism of action. How powerful is that drug? How will we come to know? When will we able to know about the efficacy of that particular drug? For that we need to know even the mechanism of action of that particular drug. So in this, when we talk about pharmacodynamics, we actually study about the what drug does to the body. Now what drug is doing in our body, that is we are studying. So drug does to the body is pharmacodynamics. In this pharmacodynamics, we actually assess several qualitative aspects, several quantitative aspects are there. When we talk about qualitative aspects, there we talk about receptors. There are different type of receptors in our body. Each and every cell has got a certain specific type of receptors. And a particular drug or a particular chemical comes and bind with those receptors and make a drug receptor complex. So, and in practical purposes, if we want any drug to produce its effect, then there has to be a drug receptor complex. There has to be a formation of drug receptor complex. Drug receptor complex is like a lock and key mechanism. For example, if we have a particular lock, then there has to be a certain particular type of key to open that lock. Similar is true with receptor. We need to have a particular drug or a particular chemical to act on those receptors, and then only they'll make a drug receptor complex and a particular effect will be produced or a desired effect will be produced. So we'll study receptors, different type of enzymes are there to produce any kind of reaction, or even for the when we are studying for their mechanism of action, certain type of enzymes are working. Selectivity of receptors are there. So we'll study all these qualitative aspects. Then in quantitative aspects, when we talk about quantitative aspect, we study about dose response. Like I mentioned that there's a receptor drug complex, drug receptor complex is there. And when this drug receptor complex is formed, then we can establish a response of particular drug, and we may plot it in a graph and can get a dose response curve. And later on I'll teach you how to go ahead with that dose response curve, how to read that dose response curve, so we can achieve that dose response curve. We can know about potency of that particular drug, therapeutic efficacy, how much effective is that drug clinically, means how much effective that drug would be for any particular disease, that we study, and the tolerance. So all these are different quantitative aspects which we study when we talk about pharmacodynamics. Now different type of definitions which are associated with pharmacology. First is clinical pharmacology. When we say clinical pharmacology, it deals with the study of drugs which produces specific type of effects in human beings. So whenever we are studying effects in human beings, we say it clinical pharmacology. And we study these effects in the healthy volunteers and even in patients. And here just a glimpse about preclinical as well. When we say clinical, means we are studying the effect of drug in the human beings. But when we talk about preclinical, means we are studying the effect of drugs in animals. So whenever we are studying the effect of drugs in animals, we say we are doing preclinical studies, and this is clinical. So it is clinical pharmacology. Next comes the experimental pharmacology. Experimental pharmacology is one when we deals with the study of drug effects in laboratory animals. So experimental pharmacology or preclinical studies, they are same. We can do it in vitro and in vivo. You know, all of you know that what is in vitro and in vivo. So if we are doing this drug study in these in vitro or in vivo environment, then we say it as an experimental pharmacology. Next comes the definition which is called pharmacotherapeutics. Wherever therapeutics word is there, therapy means we are talking about prevention or treatment of drug. So pharmacotherapeutics is the use of drugs in the prevention or treatment of a disease. Toxicology is when we talk about poisoning of drugs and their treatment. So wherever poisoning comes along with their treatment, we'll say we are talking about toxicology. Again, a very important branch of pharmacology, pharmacovigilance. It is very important from another point of view as well, that our university or our medical college is one of the pharmacovigilance adverse drug reaction monitoring center. Our Ministry of Health and Family Welfare, they run a program called Pharmacovigilance Program of India, under which we are actually assessing or trying to collect several adverse drug effects or reactions associated with certain drugs, and we need to report those reactions to higher authorities, to the central authorities. From there they collect all this data and do some analysis on that. So it comes under pharmacovigilance. So for you people, it is important to understand what the pharmacovigilance is. So if we go for by the definition, then by definition pharmacovigilance is the detection, assessment, understanding and prevention of adverse drug effects. I say it DUAP, detection, understanding, assessment and prevention, DUAP of adverse drug reactions. That is called pharmacovigilance. So whenever you people will come and go to clinical for your clinical postings, you will also see there, if any patients you find with adverse drug effect, adverse drug reaction, you need to report that adverse drug reaction to us, to the department, so that we can send it to National Coordination Center, and from where they are going to assess or understand or going to assess these adverse drug reaction and can work on that for the prevention of adverse drugs. We will be having a separate lecture on this pharmacovigilance later on. Next definition which is important is pharmacognosy. Pharmacognosy is study of crude drugs which are produced from the natural sources. Pharmacy, again an important terminology, again an important definition, as pharmacy is the curriculum of is in this new CBME curriculum of MBBS students. All of you, it is important. So what we do in pharmacy is that it is identification, selection, preservation, standardization, compounding and dispensing of drugs. So here we are actually talking about all these things which are required to make a certain kind of preparation and to dispense that. So we identify any particular chemical, select that chemical, we know or we should know how to preserve that, how to standardize that, and then compounding and dispensing of that particular chemical preparation. That will come in pharmacy. Next is pharmaceuticals. When we talk about pharmaceuticals, means we are talking about manufacturing of drugs. Next is chemotherapy. Chemotherapy is treatment of systemic malignancy with the drug. So drugs which we are using for malignancy or for cancer treatment, they are called chemotherapy. They have their effect on malignant cells with minimal or maybe no effect on the normal host cells. Then pharmacoepidemiology. Wherever the word epidemiology comes, means we are talking about a large population. So when we say pharmacoepidemiology, means we are talking about study of drug effects, drug use in a larger population. Next terminology is or a definition of pharmacoeconomics. Economy, as the word has come, economy means we are talking about cost or financial matters. So when we discuss or when we study about the drug and its cost effectiveness or its financial matters, then will come in pharmacoeconomics. What general population think is that when we are talking about pharmacoeconomics means we are talking about cost of a particular prescription. Like a patient has come to us in the OPD and we have written 3-4 medications on that. So and patient has gone to medical store and purchased that prescription. So it will be costing them around 350, 400, 500. So that would be pharmacoeconomics, but it is not exactly the same. Pharmacoeconomics deals with the larger areas. So we include so many things in this pharmacoeconomics, not only prescription cost. Apart from that, if patient is hospitalized, then there are different charges of that particular hospitalization, bed charges, nursing charges. If he has gone for a surgical procedure, then that charges will be involved. If patient has taken, if patient is hospitalized, then he has to take off from his work. Again, his attendance would be short and some salary would be deducted. That will also come in pharmacoeconomics. If I am admitted in the hospital, my kids will get suffer. They are not going to school. Again, that would be a loss. So all type of things which are associated. If patient is taking certain medication, he come across with certain kind of adverse drug reaction, Secondary to drugs, again he has to take certain other medication, or hospitalization stay can increase. So because of that, there is financial burden on patient, and everything will include in this pharmacoeconomics. So again, a very important branch of pharmacology. Now, let's move forward from this definition part. Let's come to drug. What the meaning of drug is. This drug word has come from a French word which is called drogue. The meaning of drogue, literal meaning of drogue, is dry herb. And if I go by terminologies, then a drug is a chemical substance, any kind of chemical substance that affects the process in living organisms and used for treatment, prophylaxis, or diagnosis of the disease. Treatment, prophylaxis means prevention. If we are trying to prevent something, if I am assuming something that a particular diagnosis can happen to a particular person, then I can also use certain drugs for that. And for diagnosis, certain kind of diagnosis also we use. For example, if I am diagnosing a patient of, say, pulmonary tuberculosis, and I have given a Montauk's test, that could be a diagnostic test, so that is also a drug. If I am going to visit any area which is having a huge number of malaria patients, I am presuming that I may get malaria over there, I can take certain prophylaxis or drugs to prevent a particular disease. Like all the vaccines, they are prophylactic drugs. We are using all the vaccines as for the prophylaxis purpose or for the prevention purpose. So if we are using any kind of drug that is affecting the processing living organism, and we are using it either maybe for treatment or for prevention or for diagnosis, we can call it drug. A drug is called medicine when we used in proper dosage form and for the benefit of the patient. If we are using it for patient's benefit and in proper prescribed dosages, we can call it a medicine. All medicine are drugs, but not all the drugs are medicine. It is important. Now, WHO definition of drug, which you people should know, especially if you get a kind of say short note or long question in your final exams or in your exams, then you should know the WHO definition. For understanding purpose, whatever we have discussed by far, the drug is okay. But if you have to write a WHO definition of drug, then it is a substance. Now mind each and every word of this. Each and every word is important in this definition. Drug is a substance or a product that is used or intended to be used to modify or explore physiological system or pathological states for the benefit of the recipient. So as it is saying, it is a substance. So it could be a single substance, or product means combination of more than one product, more than one substances, which is used or which we are intending to use, maybe to modify or explore physiological function or any pathological condition. And the last word is very important, for the benefit of the recipient. If we are using it for the benefit of recipient, then only it is a drug. Now let's classify drugs into categories. So drugs we classify into two categories: over-the-counter drugs and prescription drugs. These are two kinds of drugs are there: over-the-counter drugs and prescription drugs. As the name is saying, over-the-counter drugs means you can go directly to a medical store or a chemist shop and then ask that person to give you any medication. And if he gives you without a prescription, those are over-the-counter drugs. Rather, on contrast to that, prescription drugs are the drugs for which you need to have a prescription with you by a registered medical practitioner. Now these over-the-counter drugs, like if I talk about India, we may get certain more than there are a few number of drugs which are available over-the-counter drugs. But globally, if we go in the Western countries, there are very limited number of drugs, like very safer drugs which are not having any serious kind of adverse reaction, like daily use drug, like we can use say paracetamol or certain antacids kind of drug could be over-the-counter drug. Next comes the nomenclature of drugs. If we talk about nomenclature of drugs, then there are certain type of names which we give to these drugs. There could be, number one is chemical name, which is universal, which is globally universal name, means everywhere we are using the same terminology. Chemical name is the chemical structure of that particular drug, which would be giving us a chemical structure of that drug. Next comes a non-proprietary name. Non-proprietary name is actually, which is another name is generic name. What we see na, generic name, Modi ji ne shuru kiya ek Jan Aushadhi Kendra, where we are getting all kind of generic medicine. So that is non-proprietary name, which is actually approved by a particular government, like by WHO or by United States, or maybe by a particular continent. They have approved that particular name. So that is generic name or non-proprietary name. Next comes a proprietary name. Another name for that is brand name, which is actually given by pharmaceutical companies. As a particular salt is produced by several manufacturers, by several pharmaceutical companies, so they give a separate name for their own product, and that is called the brand name. For example, this is a chemical name: 7-chloro-1,3-dihydro-1-methyl-5-phenyl-2H this and dash 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 dash. So this is a chemical name for any particular entity, which is going to be true for each and everywhere, wherever you go, whether you are in US, you are in England, you are in India, you are going to use same chemical name. Next comes the official name or the generic name, which is diazepam over here. So it is an approved name by the authorities. Next is branded name. For this, branded name is which is given by pharmaceutical companies. So name is Valium, Paxum, Compose. There are so many pharmaceutical companies. Even in India, there are more than 50 pharmaceutical companies, and most of them are making this particular drug. So they have to give certain different names for their own manufacturing products, and they give those names, and these are called brand names. Now important is drug compendia. This you should just have a vague idea of this. There are pharmacopoeias and formularies. Pharmacopoeias are where there's official list of established drugs with their physical and chemical properties. So we are having in this pharmacopoeias, we are having physical and chemical properties of drugs. There are different tests for identification about their purity and potency, and it also defines about the standards and average doses of those drugs. In formulary, we are having details of pharmaceutical ingredients used in the preparation of drugs. It's just a functional classification of drugs. How do we classify drugs? There could be curative type of drugs which are important from the curative point of view. There could be suppressive drugs which will just suppress the symptomatic, whatever the symptoms are. They are not going to have any effect on the pathology of process, but they'll just suppress the symptoms. There could be prophylactic drugs. Prophylactic, as I mentioned, they are for prevention. Then empirical drugs, which are used for a broader spectrum. If we are not sure of any organism, that what organism is affecting us or producing that particular diagnosis of that particular disease, then we may go for empirical drug. This is pharmacy definition. This we have discussed earlier as well, so no need to go in detail. Different nature and sources of drugs. We are having different type of sources from where we get these drugs. Like we may get from the mineral sources, example magnesium sulfate, aluminum hydroxide. So there are magnesium hydroxide, we use these as antacids. They are originated from minerals. There are sources of animals from where we can originate, where we are originating insulin, thyroid extract, heparin. Then these drugs like morphine, digoxin, quinine, they are originated from plants. Certain drugs are produced by the synthetic origin. We are producing in the lab as well, aspirin, sulfonamides, all these are there. We are producing certain drugs with the help of microorganisms, like penicillin is derived from Penicillium notatum, streptomycin from Streptomyces gracias. We may produce certain kind of drugs by the genetic engineering or by the hybridoma techniques. So these are certain techniques or certain sources of drugs from where we can get these drugs. These are different type of active ingredients. Next come the dosage forms. What are different dosage forms? Dosage forms are the forms in which these drugs are available. So drug could be available in the form of powder, which maybe we can use for external use, for oral use. There are effervescent powders as well in the granular forms available. For external use, like we have soframycin powder. If we get any kind of ulcer or any kind of infection, we may put a dusting powder of soframycin over that for external use. For oral use, oral rehydration powder or oral rehydration salt, ORS, all of you are aware of that. So that is oral, that is example of oral powder preparation. Effervescent powder like Eno, all of you have seen. Otherwise, Disprin is available, in which we have
a drug is mixed with citric acid and bicarbonates. As soon as we mix it with water, there's an effervescence. Drugs could be available in the granular forms. So all these are powder preparations. Then we may have tablets preparation. Tablet is available, which may be in the powdered drug, which is compressed under heavy pressure. Usually ordinary tablet. We may have sugar coated tablet. For example, all the bitter salts which are bitter in taste, we may mask the taste of that particular drug for the better compliance and can sugar coat that. Like chloroquine tablet. We may have film coated tablet or enteric coated tablet. Enteric coated tablets are which are going to dissolve in the intestine. They are not going to dissolve in stomach. So the drugs which we want to get release their active ingredient in intestine, we coat them and in them enteric coated tablet. Then long tablets or retard tablets, or we may call them extended release tablet, in which there is a uniform and sustained release of active ingredient within 10 to 12 hours. For example, diclofenac sustained release, ibugesic sustained release. There are several sustained release tablets available in the market. So these are there. Then lozenges, in which we are having drugs with sugar and gum. They are meant for sucking. Like most of you have heard of those strepsils kind of lozenges. Then capsules, where drug is available in gelatin shell. And long-acting capsules, they are called spensules. Okay. Then syrups, where drugs is concentrated in the sugar solution along with some flavoring agents. So injections are available where sterile solution in suitable solvent and preservatives are there. And enema, they are the medicaments which are liquid preparations for rectal use. So that is all for today's lecture. That is just a general overview of pharmacology. Next time we will be starting with one of the system of general pharmacology. Till then, take care all of you and good day.